How should parents manage fever in young children with sickle cell disease? When your child with sickle cell disease develops a fever, it can be very worrying. Fever in these children is considered a medical emergency because they are at higher risk for serious bacterial infections. This is because sickle cell disease affects the spleen, which normally helps fight infections. When the spleen doesn't work properly, bacteria can cause infections that may become life-threatening quickly. The first step is to recognize that any fever of 101 degrees Fahrenheit or higher needs urgent medical attention. Do not wait or try to treat it at home alone. Take your child to the emergency room or call your healthcare provider right away. Prompt evaluation is crucial because fever can be the only sign of a serious infection that needs immediate treatment. Once at the healthcare facility, your child will likely have blood tests, such as a complete blood count and blood cultures to check for infection. Sometimes a chest X-ray is done if your child has cough or breathing issues. Doctors will often start intravenous antibiotics quickly to treat bacterial infections, especially those caused by bacteria like Streptococcus pneumoniae and Haemophilus influenzae, which children with sickle cell disease are more vulnerable to. Children with sickle cell disease should also be on daily penicillin from 2 months of age to help prevent bacterial infections. It is very important that they stay up to date with all recommended vaccines, including those that protect against encapsulated bacteria. Vaccinations and penicillin help reduce the risk of serious infections before any fever occurs. At home, you can give your child fever-reducing medicines such as acetaminophen or ibuprofen to help with discomfort and lower the fever. Remember, these medicines are only for comfort and do not replace the need for urgent medical care. Always check your child's temperature before giving medication and watch for other signs of infection like cough, trouble breathing, extreme tiredness, irritability, pale skin, vomiting, or diarrhea. If any of these appear, seek medical help immediately. After initial treatment, some children may be managed as outpatients if they are low risk, but many will need to stay in the hospital for close monitoring and intravenous antibiotics. Follow your healthcare provider's advice carefully and return to the hospital if your child's condition worsens or new symptoms develop. In summary, if your child with sickle cell disease has a fever, treat it as a serious health issue. Get medical help right away for evaluation and treatment. Keep up with daily penicillin and vaccinations to prevent infections. Use fever medicines to help your child feel better, but remember they do not replace urgent medical care. Always consult your child's healthcare team for personalized advice, as each child's situation can be different. Acting quickly can make a big difference in keeping your child safe and healthy.